Saturday in Cleveland, Tennessee. Doors open at 6 a.m. each day. First come, first serve.
Every month we're very lucky because the Hamilton County Health Department comes our way, and if you've been watching, you've learned that there's almost nothing they don't do at the health department when it comes to your health and that of our community. And it's kind of the community that we're focusing on with them this morning. Alvarez is with the TB clinic there at the health department, and I was just telling him, you know, I know the word tuberculosis, but I don't really know a whole lot about it. So great was my ignorance that I thought that there was a vaccine for it, but there is not.
Well, there is a vaccine for it in other parts of the world, but not in the United States. That vaccine is called a BCG vaccine, but we don't vaccinate for it because it has a somewhat of a limited efficacy for the TB disease.
We just don't talk about it a lot, I guess because our numbers here traditionally are not that high, yet next week is World TB Awareness Day. So are we seeing kind of throughout the world an increase in it?
Since the year 2000, 75 million lives have been saved through the efforts of TB intervention. Unfortunately, and it's still a sad fact that close to 3,500 plus people die every day of TB throughout the world. Of course, some nations carry that burden a whole lot heavier than a first world nation,
sure,
such as the U.S. But you know, we still have our own deaths here in the United States.
It is treatable, it is curable. Before we went on air, you said of all the terrible diseases, if you had to get one, this is the one that you would want to get. So
yes.
What is TB exactly?
TB is an infection that primarily infects the lungs. So you and I are talking. I may be sick of the TB disease. You breathe in the air that we're both breathing in, and then I infect you. Mm-hmm. In time, your immune system may become compromised, and so then you become sick of it too.
So at the TB clinic, are you yourself treating patients when they come in?
We do.
Okay.
We test them first and foremost. If they have the TB infection, mm-hmm, we will go ahead and offer treatment for latent TB infection.
And what are the signs of it?
The signs are night sweats, weight loss, loss of appetite, coughing up blood. Those are concerning symptoms that we need to be on the lookout for.
So for you personally, I'm prying here, but if you can get it by talking to somebody, it's airborne, you must have to be very careful.
Yes, of course, we must be very careful. But we have been made in such a phenomenal way. Your immune system recognizes the bacteria and it holds it, it keeps it secure. And it will do so until your immune system becomes compromised. And then it'll just let it go, and that's when we become sick.
Okay, so let's give an example. We have a couple of minutes left. Let's say that somebody comes to you and they're a mother with a husband and 3 kids at home. And she's presenting with some of these symptoms, so they come to the clinic, you do the test, sure enough it's tuberculosis. So you begin to treat her. Do you also need to treat everybody else in her family?
Well, no, not necessarily. We will test everyone else in the family. If they've become infected, we will of course treat them for latent TB infection. Mm-hmm. You know, we will test, we will x-ray, and we will take it from there.
Since it is a communicable disease, essentially, is there anything that we should all do as a community to try to prevent it?
Well, unfortunately, there is no way of knowing who is walking around with active TB disease because we
can't know. It's unseen.
Know.
Yeah.
Yes.
Okay. So hand washing really important, or no, because it's airborne?
It's airborne.
Okay.
Of course, hand washing is important for all things. Yes.
So if we're going to give people the phone number to call in case they suspect that they are experiencing some symptoms. So it's night sweats, coughing up blood, weight loss, and loss of appetite?
Yes.
Were those the 4?
Yes.
Okay, and then here's the information that you need, because it is, as you heard Ish say, treatable and curable. So don't be afraid, especially the earlier you can get help, the
Exactly,
better.
right.
So 209-8030
8030, yes.
and our help.hamiltontn.org. You make it very comfortable to talk to you. Thank you.
Shake off those winter blues with some retail therapy at Mercantile at the Ranch. Browse over 100 shops, all under one roof. Apparel, home decor, and so much more. Lots to see at Mercantile at the Ranch, Ringgold Road, East Ridge, exit 1 off I-75.
I got hurt in the car wreck. Give me one good reason why I should call the Insiders.
How about 3 great reasons you should call us?
1, it's easy.
2, it's fast.
3, the results. If you've been hurt in a car wreck, call us.
It's just that easy.
Muhammad's been awesome. Known him for years, probably about 12 years and going, and he's been here every step of the way. Best prices in Chattanooga. I've had many stores and many competitive prices.